I've had a great day today with some of my fellow ambassadors from the Academy of Fabulous Stuff at the Wrightington, Wigan and Lee Quality Champions Conference here in Wigan.
That's easy for him to say.
Now, one of the keynote speakers has been the legendary Roy Lilley. So we thought we'd just grab a few moments of Roy's time to just ask him a couple of quick questions around quality. So, Roy, how well do you think the NHS has been at embedding quality? And do you think the kind of enthusiasm and excitement we've seen here at the conference today is being translated into care for patients?
Well, let's do the easy questions then. Right, how well do I think? Look, I think the NHS actually does very well on quality. When you think today, whilst we've been at this conference, 1 million people will have been cared for either in hospital or primary care or community care or in the pharmacy. A huge number of people get looked after every day. Now, we do make mistakes. We do make errors. We do. With that kind of volume, people are human and things go wrong. And I'm not saying that any of it is right, but when you look at it as a percentage of the volume that goes through, actually I think the NHS does very well. There's a lot of talk about zero defects in the NHS, and you can get to zero defects. You can put processes in place to make sure that you reduce the number of mistakes and errors that there are. You can have protocols in place. And for example, in surgery, you've got the World Health Organization's criteria and checklist. But, and this is the but, if you want to get to zero defects, it will cost you every penny you've got to do it. And so I'm not excusing mistakes, I'm not excusing errors, but I think in the total scheme of things, I'm pretty sure the NHS is one of the safest in the world, particularly when you look at prescribing errors, for example, that there are in the States and what have you. I'm not saying it's perfect, but I'm not saying we shouldn't reach for better, but I'm also saying I don't think we should really beat ourselves up. As far as days like today is concerned, and we've had a great day, haven't we? We've heard some really terrific people. I think it kind of re-energises people if they go away with a new idea. I tell you something very interesting. What they're doing here is something that I was involved with back in the early 90s. They're trying to do day case surgery for hip operations, and they're successfully doing it here as well. And a lot of it's about pain block and pain control when the patient's discharged. Now, we judged a series of posters earlier today, and there's a breast cancer surgery going on here now, and they're doing that as day case. And a large part of that is post-operative pain blocking and pain management for patients. And the two people doing the two things didn't know in the one organisation. They were both more or less doing the same sort of thing. So as far as today is concerned, I think firstly it gets people to look around the organisation and see what there is to share. And secondly, we look at outside the organisation at new ideas. Helen Bevan, of course, has brought in some new ideas. I my contribution, I hope I make people think about quality. So I think it re-energises people, it takes them away from the front line so they can just have a bit of time for themselves. And let's face it, the great trick in management is creating the time and space for good people to do great things.
Thanks, Roy.